Hello, dear students. This is Dr. Tahira, study EFOG mentor, and today I am with you with our SSS YouTube series for your upcoming exam. Wish you best of luck for the exam. I will talk about today some history taking skills and tips which will help you in your exam. You know, this is 11 minutes station in which you have to take complete history for the you have to summarize this history to your colleague. So let's start. So the success of your secret of your success is determined by your hard work and a strong focus on your goal. So best of luck for your exam and have a tips. So it will help you to uh, pass your exam in with flying colors. So in the history taking and summarize, I'll talk about two cases, heavy menstrual bleeding and preterm pre-labor rupture of membranes with the patient who is presenting with the penicillin allergy. So I'm giving you a task that you are a registrar in the gynae clinic today and about to see a 40-year-old woman with heavy menstrual bleeding associated with passage of clots and pain. She also complains about the intermenstrual bleeding. She is nulliparous and wants to conceive. You have 11 minutes to take complete history, then summarize the case to your colleague. So now the template, as you all know, that we have to introduce ourselves and you have to ask about the personal biodata from the patient. Then you will talk about the history of presenting complaint, then gynecology history if it is a gynae case, then obstetric history, past medical history, family history, surgical history, social history, drug history, and allergies, and if she has any reservation for the blood transfusion. And then you have to do the mental screening also. So I'm giving you the tips that if the patient is presenting with the heavy menstrual bleeding, what you have to ask the specific question. And if she is presenting with the urinary symptoms or any vaginal discharge or any malignancy. So shortly, I'm talking about this and then I will talk about the case. So let's see the patient details. You have to confirm with her name and age. Then you have to ask the menstrual status, perimenopausal or postmenopausal, parity and live birth, working as she's working, or what is her occupation. Does she has enough support at home, and her socioeconomic status, marital status, unmarried, widow, divorced or separated. Now, in the history of presenting a chief, you have to ask about the chief complaints. Vaginal discharge with or without the pruritus, color, consistency, duration, bleeding per vagina, clots, flooding, how many pads, onset, duration, intermenstrual bleeding, postcoital bleeding. If it is mass per abdomen, then you have to ask about the gradual or sudden onset, consistency, mass discharging per vagina, or pain in abdominal pelvis, duration, onset, association, aggravating and relieving factors. Now, our patient is with the history of the heavy menstrual bleeding. Then you can ask the open question. Always remember, whenever you will open question, then patient will be, the rapid with the patient will be built, and then she will open up and give you the correct answer and full information. So can you tell me that about your complaints or what brought you today in the clinic? When you started this bleeding, it is heavy like a periods, how many pads per day you are using, how many time these bleeding is persisting, or how many pads are you using? Is it associated with the passage of clots or there is a flooding? Do you experience any bleeding in between the periods? If you don't mind, if I ask some personal questions, are you currently in a relationship? Are you sexually active? Do you have bleeding after the sex? Or have you noticed any vaginal discharge? Now we have to ask about some specific question if the vaginal discharge is there. So onset and duration, amount, quantity, scanty, moderate, excessive, type of discharge, consistent, thick, thin, frothy, watery or pussy, color white, greenish, gray or yellowish. You have to ask about the odor or smell. periodical discharge, continuous or intermittent, blood stained or not, to the cycles or associated with the pruritus and irritation. And regarding the bleeding, as I explained, the pattern of the bleeding, polymenorrhagia, oligomenorrhea, metrorrhagia, menstrual history, rhythm, amount and quantity of flow associated with the clots and the pain, duration of the bleeding, interval between two bleedings, continuous, intermittent, onset, postcoital bleeding, intermenstrual bleeding, or previous history of the sexually transmitted infection, tuberculosis, oral contraceptive pills, or IUCD insertion. Then you have to ask about the specific question about the mass per abdomen, onset, sudden, insidious, gradual, duration, size and growth rate, associated with pain, pressure symptoms for mass abdominal might be dyspepsia or abdominal distension or the sensation of the bloating after the meals and loss of appetite, weight loss, dull abdominal pain, dyspnea, nausea, vomiting, or any history of the fetal edema. Now you have to ask about the pain. Pain, we know the specific question. Onset, sudden or insidious. Site, it is generalized, localized. Duration, nature of the pain, and relation to the cycles, radiation, aggravating and the relieving factors associated with the vomiting of fever, history of loss of appetite and weight loss, history of palpitation, dizziness, anemia symptoms. So you have to rule out the anemia. Then relation with the bowel and the bladder. So if it is a pelvic mass which is occupying whole pelvis, then there will be the ureter obstruction, hydronephrosis, abdominal mass, and fibroid. It could be your patient will give the pressure symptoms, that is increased frequency of urine, urinary retention, difficulty in urine, history of increased frequency of micturition, dysuria, hematuria, incontinence, fistula formation. And urinary leakage also, history of the rectal involvement, diarrhea, constipation, rectal pain, bleeding per rectum, or the fistula formation. Now the gynecological history, menstrual history, age of menarche, attend menopause at what age, cycles, regular, irregular frequency, days of flow, volume associated with clots, pain, history of intermenstrual, post-menopausal bleeding, last menstrual period, and what she's up to date about her pap smear, and when the last pap smear has been done, was it normal or not? Marital status, number of children, and age of the last child birth, contraception used or not, oral contraceptive or IUCDs, and then obstetrical history, number of children, number of live births, intrapartum, postpartum, or and any complications. Then you have to ask here history of infertility, recurrent abortions, age at the time of marriage, at the age at the time of the first child and second child, history of breastfeeding, interval, birth spacing, and operative procedures like forceps or vacuum, because it will help you to diagnose if it is any prolapse case. Past medical history, tuberculosis, pelvic inflammatory disease, hypertension, problem, diabetes, endocrine, thyroid, or any history in person in the patient like colonic endometrial cancer, ovarian, breast cancer. Now, if it is the history of patient is with subfertility, then obstetric history, again infertility, parity, recurrent miscarriages, menstrual history, age of menarche and menopause at early, cycles, regular, frequency, irregular, and history of intermenstrual bleeding or postcoital bleeding, and last menstrual period. Then you have to ask about the sexual history, and it is a very sensitive time. Here you have to signpost and you have to ask from the patient very sensitively, frequency and adequacy of the history of dyspareunia, pain at the beginning or end of the act, history of semen coming out immediately, satisfactory or not, history of lubricants, other issues like burning or irritation. Then you have to ask about the male partner, definitely, that has he fathered before, then confirm his identity, name, age, younger, older, occupation, type of work, heavy or light, work hours, exposure to toxins, history of trauma, type, age, surgery, testis affected or not, sexual history, frequency, ejaculation, and history of lubrication. Then past medical history, diabetes, hypertension, psychosis, mumps, otitis, and you have to ask about the drugs history, antihistamine, steroids, epilepsy, or drugs, gastritis like antacids, thyroid, sexually transmitted infections, testosterone, and adjuvants, any medication he is taking or not. Past physical history, hydrocele hernia, orchidectomy, testicular biopsy, appendix, or cholecystectomy. In the family history, you have to ask about the hypertension, diabetes, any cancers, infertility, sibling, personal history, smoking, alcohol, and the substance use. In the personal history, definitely we have to ask about the allergy to the any medication, history of drug intake, addictions, alcohol, tobacco, smoking, diet, high-fired diet, or obesity. We have to ask about a high risk of the behavior, multiple sex partners, STDs, and dyspareunia. In the family history, we have to exclude also the history of any cancer of the colon, endometrium, ovarian, and breast cancers. We have to discuss about the, ask about diabetes, hypertension, tuberculosis, bleeding disorders, and fibroids. Also, we have to ask any non-specific like cervical or cancer or the prolapse in the patient. Now, after this, we have to summarize the case. In summary, we can say my patient 40 years old, perimenopausal or premature postmenopausal, she is sterilized or not, para 1+0 or nulliparous, and whatever the comorbidity associated patient presenting with the heavy menstrual bleeding with subfertility. And if she has any comorbidity, we can say known case of diabetes or hypertension, she is taking medications. So these are the, on the history basis of history and examination, my probable diagnosis, if it is menorrhagia with subarachnoid or it is fibroid uterus, we have to say. Now, regarding our case, the other best form to present to the examiner is S bar 2. Introduction of yourself. I'm Dr. XY, I'm XYZ, an exam candidate. I'm ready for the discussion. So, case of heavy menstrual bleeding with subfertility stand for S. B background, my patient is 40 years, nulliparata with a probable case of the menorrhagia with fertility, and this menorrhagia may be due to the multiple fibroids or fibroid uterus. So my assessment, history, investigation, observation, and other risk factors I have to exclude. And then my recommendations regarding pain management, weight reduction, further imaging, the need of ovulation reduction, or refer to the fertility center. So in this way, we have to present our case. And if the examiner, he wants to ask any case related questions, he will ask from you. So I hope that it will help you. Now, for our case. So we have to say that this is the best template which I'm going to discuss with you now. So after introduction, ask name and age, check patient understanding. Then ask since when she started this complaints of heavy periods, associated with the clots of flooding, how many pads per day, and any history of the intermenstrual and postcoital bleeding, associated with the pain, aggravating, relieving factors. Did she notice abdominal swelling since when, and any pain during the menstruation? Any history of the breast clots, change in appetite, symptoms of anemia, breathlessness, palpitation, easy fatigue. In pressure symptoms of history of retention of urine, any pain, urgency, dribbling, incomplete emptying of the bladder, any history of the open in her bowel, if she is taking enough fluid, coffee intake, spicy food, is regards to heavy bleeding, symptoms of thyroid, palpitation, heat and cold intolerance, weight loss, weight gain. Is this affecting her quality of life or her sexual life? Then we have to ask about the bowel symptoms, constipation, difficult bowel movements. We have to ask about the size, if it is gradual and increasing, any extent tummy which can cause you to look pregnant, or disturbing her quality of life due to heavy painful periods, affecting socially, mentally, and physically. Fertility problems would be there, and we have to also screen her depression, low mood, and psychological disturbance. Then in the menstrual history, since how long periods stop, are you taking any hormone replacement therapy? Are you up to date with your pap smears? Gynae history, any complaints of discharge, bulge, bleeding? Obstetric history, have you ever been pregnant before? Parity, mode of previous children's. If she reproductive age, then ask for the further future fertility as it may change her management. Medical history, chronic obstetric pulmonary disease, chronic cough, constipation, asthma, if it is related to the prolapse or urinary incontinence, if the patient is presenting with that. Surgery, we have to exclude any surgeries, fibroid, of family history of the fibroid, and particularly also we have to ask from the patient, it is running in the families. Then we have to ask her that what with whom she is living. Do you have any spot at home? What do you do for a living? Then we can say that, Mary, for how long have you been trying for the pregnancy? Have you ever been offered any treatment, or not till now she received any treatment? Then we have to ask about what happened if she had any history of hysterosalpingogram she did or not, or she used any analgesia or not. Then we have to ask about the if she had any pregnancies before, and if she's feeling that about the sexual history, that then you have to signpost. I'm sorry that if you find any questions including or on you, but can you tell me more about your sexual life? How often per week do you have unprotected sexual intercourse? Any difficulties or pain during the sex? Is there any history of vaginal discharge or lower abdominal pain or sex sharing disease in the past? We have to exclude sexually transmitted disease. I'm sorry to ask a few questions about that are personal, but have to ask to decide for your proper management. So, have you had any sexual relations before? Have you ever had sex shared disease in the past for which you were treated? Are you following with your GP for any health issues, any surgeries in your tummy or lower abdominal or lower down below? So in this manner, we have to ask about the sexual history. Then about the personal history, do you smoke? Do you consume or drink alcohol or having any recreational drugs? What do you do for a living? Can I ask you a question about your partner? How old he is? What does he do for a living? Has he fathered any children before? Is he following up with his GP for any health issues? Is he currently taking any medications? Has he undergone any surgery before? Does he smoke or drink alcohol or using recreational drugs? Does he support you at home? In the last 4 weeks, did you feel loss of interest in doing things or low mood? Because they are very particularly because of long-standing issues and disturbing their quality of life, they are psychologically disturbed. So this is the case about the gynae related, and what I discussed with you, these are the important history points which will help you in your upcoming exam. Now I'm going to discuss with you the obstetric case, that is pre-labor preterm rupture of membranes. The patient is allergic with the penicillin. So you are registered in labor ward and you have been called for emergency department to see a pregnant lady who came to the emergency department at 2 a.m. She is a 32 years old, gravida 3 para 2 plus 0 at 32 weeks gestation, present with the complaints of watery vaginal discharge with mild lower abdominal pain and discomfort. She is allergic to penicillin, and your task is to take detailed history and then present to your colleague. You have 11 minutes to finish your task. So guys, obstetric history, definitely, again, I'm giving you the first tips: patient details, name, husband name, education, age, occupation. About education, you can ask something. Then you have to ask about the obstetric history. obstetric history, gravida, parity, live birth, abortion, and you have to ask about the last menstrual period to correspond her gestation age according to the ultrasound also. Then you have to calculate her estimated date of delivery, and you have asked if she's booked her or not, did she has that received any immunization before or not. Then history of presenting complaint you have to ask about, since how long she has this uh, leakage of vaginal discharge, what she was doing, sudden onset, gradually, was it what is the consistency, watery or thick, thin, color, so amount, and any associated with the pains or any bleeding PV. Okay, then elaborate the symptoms. We have to exclude the causes with risk factors. We have to ask about the fetal movements, and we have to ask only past medical. So in the obstetric patients, always remember we have to ask the trimester wise, first trimester, second trimester, and third trimester. In the pregnancy, you have to ask, is it the planned pregnancy or spontaneous, and it is IVF pregnancy. And then you have to ask about the first trimester when she had the booking, and you have to ask about the regarding the how she confirmed the pregnancy till now, how many visits she has with the antenatal, did she had any in the first trimester any nausea, vomitings, any flu-like symptoms, rash or fever, any radiation exposure, any bleeding PV or urinary tract infections, discharge, and about the drugs, did she took the folic acid, did she had her first trimester anti-scan corresponding with her gestational age or not. And in the second trimester, you have also asked about the number of antenatal visits, about her weight and gain and the BMI, what investigations she did regarding Down syndrome screening, regarding her gestational diabetes screening, and when she first had her quickening meeting, meaning that fetal movements, any high blood pressure records in the antenatal period or no till now. And you have to ask about the any signs of high blood pressure, gestational hypertension, fetal edema. You have, and here also you have stark any history of bleeding PV or drugs what she is taking. In the third trimester, again, number of antenatal visits, weight gain, history of gestational diabetes or high blood pressure, and any labor pain, any pruritus. Menstrual history, menarche cycles, frequency or not. Then marital status, again, number of years of marriage, numbers of children, cousin marriage or history of any infertility or not. Okay, now we have to ask about the previous obstetric history. So how many times she has been pregnant, how many children she has, what are the mode of deliveries, antenatal, intrapartum, and postpartum, any complications. We have to ask all about that, whether she has the any normal delivery or cesarean sections, what are indications, and what about her postnatal and postpartum recovery, or if the baby's delivered, any NICU admissions, breastfeeding or not, and how regarding her blood group, did she receive any anti-D? Then discuss about the contraception and birth spacing, and regarding the previous cesarean sections, previous stillbirths or any abortions. Past medical history, we have to ask whatever the past medical history like diabetes, hypertension, any epilepsy, any blood transfusions, any reservations she has any in the past about the like Jehovah's Witness or not, and did she had any advance directive for her not signed, and regarding her past personal history, again, what about her support at home, what about her appetite, what about her bladder and bowel history, and social history, smoking, alcohol, and the mental health screening also you have to ask about from her. Now, here we have to say that Sarah, hello, Mr. Sarah, I'm one of the doctor in the clinic today. May I confirm your name in this show? Would you like me to call you Sarah? I've been called to take care of you. But first, may I ask what brought you here today, Sarah? She will tell you that I had a vaginal discharge. Since yesterday, I'm concerned about my baby. Okay, Sarah, I understand. In order to arrange a care plan for you, I need to ask a few questions. I may need to examine you and request some tests, and then we can discuss your care plan. Is that okay? So, how old are you? She will say 30 years. So, pregnant, current pregnancy. Can you tell me more about this chart? Then we will put the differential diagnosis in our mind. Then I ask the specific question to get more information. So if it is the pre-labor rupture of males, might be incontinence or maybe have infection in mind. So in the pre-labor rupture of membranes, we will ask about the gush, just like a leak, color, smell, amount, any blood loss, any pain in your tummy or fever. What about your baby's movements? Or if it is incontinence, any problems with your water works before. So how the pregnancy so far right now? I'm 32 weeks. Any problem so far? No, doctor. Ever been pregnant? This is my third pregnancy. Can you tell more about both vaginal disease and fine and any similar condition in those two pregnancies? Were they delivered at term? So you will ask about the relevant here is the cervical smear. My last smear was abnormal and had a treatment for that. I was offered a procedure called LITS or suture around the neck of the womb or something. She will tell you. So we can ask these relevant question. So you will know what is the reason about the pre-labor rupture of membranes, or it is a by unknown cause. Family history, drug history, again you have to ask about, and she will say that if you will ask about the social history, she will tell you that yes, I'm generally fit and fine, but I have, is she supportive at home or no? Then she will tell you about, if you will ask about the smoking, yeah, she smokes 10 to 15 cigarettes per day. Then here you can say that, Sarah, you know that smoking is not, is hazardous to our health. And if you want to quit, I can attach you with the smoking cessation program. So there and there acknowledge her. Then you can, after this, do the mental health screening, that in the last 4 weeks, did you felt that low moods or loss of interest to doing work? And then you can say literally that it looks that your water has broke. If your water breaks when you are less than 37 weeks, but you are not in labor, this is called preterm pre-labor rupture of membranes, or PPROM for, we can say. And then you can say, Sarah, if you let me do a quick review about what you have. Just you told me that about your history. You're 35 years old and you're 32 weeks gestation into your third pregnancy. You came here today as you have watery loss for the past 4 hours. You do smoke and willing to stop. You are allergic to the penicillin. So penicillin, when she will tell us, we can say, okay, can you tell me what happened when you had this injection penicillin? So she will tell you that she has the generalized rash, difficulty in breathing. And so you can tell, okay, I will note it down in your documents and your records. So once you will be hospitalized, so your doctor can know that you are allergic with penicillin. So again, summarize the case to the colleague. I'm XYZ. I'm the exam candidate. And my case is case of pre-labor term rupture of membranes. Her background, she's gravid at 3 para 2 plus 0 at 32 weeks gestation. with pre-labor preterm rupture of membranes, and she's allergic with penicillin. And the assessment, her observations for abdominal examination and perispecific examination to be done. And then her recommendation after history examination investigation will put the management plan. So guys, this is regarding about the history tips, which will help you in your upcoming exam. So wish you good luck for your exam. Might be these tips will help you, and be concentrate what the task is given. Only you have to concentrate to take the full history in your this 11 minutes. Then you have to present this history to your colleague. So you should not do the examination. You should not discuss any investigations. You have to take the detailed history, which the tips I discuss with you right now. So might be it will help you. Goodbye and very best of luck for the upcoming exam. Thank you, guys.